Hi, today we will talk about hepatitis B. The hepatitis B virus HBV is the cause of hepatitis B, a potentially serious liver illness. It is a serious issue for global health. It can result in persistent infection and greatly increase the risk of cirrhosis and liver cancer related death. Hepatitis B is often a short-term condition, also known as acute, that lasts less than 6 months for most people. However, have chronic infections which linger for longer than 6 months. You run a higher chance of getting cirrhosis, a disorder that permanently scars the liver, or liver cancer if you have chronic hepatitis B. Hepatitis B acute symptoms might be mild or severe, though you could see them as soon as 2 weeks after infection. They often appear 1 to 4 months after infection. Some people, generally young children, may not exhibit any symptoms. Here are some symptoms and indicators of hepatitis B is here. Number 1, abdominal pain. Number 2, dark urine. Number 3, fever. Number 4, joint pain. Number 5, loss of appetite. And number 6, nausea and vomiting. And number 7, weakness and fatigue. Now the question arises here that how hepatitis B is spread. So there are some reasons that's why hepatitis B is spread. Number 1, sexual contact. If you engage in unprotected sex with a person who has hepatitis B, you could contract it. If the person's blood, saliva, semen, or vaginal fluids go inside of you, the virus can get into you. And number 2, needle sharing. Needles and syringes laced with infected blood become excellent carriers of HBV. Hepatitis B is very likely to spread when IV medication supplies are shared. And number 3, accidentally sticking a needle. For everybody who comes into touch with human blood, including healthcare personnel, hepatitis B is a problem. And number 4, mother to baby. During childbirth, pregnant women with HPV infection transmitting the virus to the baby, whereas in virtually all circumstances, a newborn baby can be immunized to prevent being ill. So if you are plan to become pregnant, speak with your doctor about getting test for hepatitis B. Second question is how to prevent from hepatitis B. So some precautions can follow from hepatitis B. Number 1, hepatitis B vaccination. The most effective strategy to prevent hepatitis B is by vaccination. Usually 3 or 4 shots are administered in a row, spaced 6 months apart. Long-lasting immunity against the virus is provided by the vaccination, which is secure and very effective. Number 2, practice safe sex. Hepatitis B can be spread through sexual contact. So use caution with having sex. Use barrier method of contraception such as condom during sexual activity to lower the chance of infection. Having several sexual partners or engaging in high risk sexual behavior can both raise the risk of catching the virus. So keep that in mind as well. Number 3. Precautions should be taken in healthcare environment. If you are receiving medical treatment or working in a healthcare environment, be sure that all equipment has been thoroughly sterilized to avoid contact with contaminated blood or bodily fluids. Healthcare professionals should adhere to general safety procedures, including wear gloves and other protective gear. And number 4, maintain proper hygiene. Carefully wash your hands with soap and water after using the toilet, before eating or preparing food, and after touching blood or other bodily fluids. Never share personal goods like toothbrush, razor, and nail clipper because they might be infected with the virus. Always remember that the best defense against hepatitis B is prevention. You can dramatically lower your chance of getting hepatitis B and spreading it by taking these preventive action and raising awareness of the infection. So if you want to secure from hepatitis B, please follow these precautions.